Okay, so I'm just gonna run through this like I do when I leave a postpartum family. So I usually go up to the birthing person and I say, "Hi, Sarah. Like, we're kind of wrapping things up. Is there anything else that you can think of that you need from us at the moment?" Um, so we kind of have that conversation, and then we usually say we're going to do one last round of vital signs for you, and listen to the baby one last time, and make sure everything's good there. And then usually what we say is we're going to run through your postpartum instructions. This is everything that you'll kind of need to know until we come back. If there's any questions from now until we come back, please call us or text us. We are still on call and available to you with anything that you are worried about. So from now until we come back, usually we come back within 24 hours, we don't want you to be left alone. So there needs to be someone in the house with you at all times. This is because someone that can call 911, like an adult, not just the kiddos and the baby, but someone that can really get help if anything comes up. So just until we come back, someone needs to be here with you. We want you being in bed. We want you resting. Don't use the stairs. Get up only to use the bathroom. Have people bring food to you. Have snacks beside your bed. Make sure your water's full. That's going to need to be refilled throughout the night and the day. You're going to want to try to be eating just as much as you were when you were pregnant. So between 80 and 100 grams of protein and 80 to 100 ounces of water. You can add in some electrolytes to that, but you really want to make sure your nutrition is staying on point and that you're staying in bed resting. Your body's in this hyper healing mode for the next 2 weeks. So we really want you in bed and taking naps and sleeping. We want you to take your temperature for the first 3 days, twice a day, so morning and night, for you and your little one. And you can just write that down on a piece of paper or have your partner remind you and do that for you. There's going to be a lot going on. So if that can be someone else's job to remember that would be great. If you have any warning signs, we want you to call us, take a picture, send it to us immediately if you can. So if you begin bleeding enough to soak through a pad in less than 30 minutes, you pass a clot larger than an egg, you have a temperature of 100.4, your bleeding has a strange odor or color, please let us know. You notice an increase in pain, particularly around your suture area. It's going to feel tender and really uncomfortable, but you shouldn't be in like agony. Additional pain around your, like where your uterus is, so that's below your belly button at this point. At your belly button or below your belly button is where it should be. If there's any increased pain or tenderness there, please let us know. If you faint or feel lightheaded, you have any other concerning symptoms where you're like, I just don't feel right, please reach out to your midwives. What to expect from your body as it transitions. Postpartum cramps are pretty normal. That's your uterus cramping down to get back behind your pubic bone, to decrease the bleeding and kind of shrink right back down. So that's normal. The way that your body works and the mechanism behind that is when your baby nurses, it helps to kick cramps up a notch and helps your uterus to kind of reduce back down. So you might notice an increase of cramping during that time where you start a nursing session. Things that can help with that is actually emptying your bladder. Your bladder and your uterus fight for that same space. So if you eliminate one of those, it can help with cramps. Additionally, you can take cramp bark tincture, which we usually leave with our mamas. You can take that as often as you need to. That will help with the cramps. If they get too intense to even like nurse your baby or sleep, or eat, if any of those are being affected, we want you to take something because those are the most important things. You are also allowed to take ibuprofen. You can take 400 milligrams every 4 to 6 hours as needed. So that's an option too. We're going to want you to check the firmness of your uterus. So you're going to want to go in at your belly button, and we always do this with our mamas. Go in at your belly button. You're going to feel for that grapefruit size ball in there. If it doesn't feel super firm, we want you to massage it really, really good and until it firms up. You can do that before you get up to go to the bathroom. That will help with increased bleeding. And yes, what else do I have to say about that? Okay. Your bleeding should look and smell similar to like a regular period. Some small clots are normal, larger ones are not, like I said, to let us know of that. It's very normal to feel a gush as you stand up. So if you're going to be laying down, you're going to be really resting. You're not going to even be really sitting up that much in bed. Of course, you can to nurse your baby or get comfortable in those positions, but you really want to like get off your bottom and really take some deep time of rest. So when you get out of bed, the blood often pools in your vagina, and then you stand up and there's a small gush that comes out. So that is normal. Your perineum, vagina and rectum may feel very sore. A cold or warm compress or Sid's bath is fine. You can rinse with the herbs or witch hazel that we put in your peri bottle. If you have stitches, remember to keep your knees together for the first 5 to 7 days. Call us if you experience an increased pain or drainage or any abnormal smell. If you notice that you're sweating a lot or urinating a lot, that's normal. It's your body getting rid of the hormones, and it's shifting back over to not being pregnant. You may experience this emotional shift. It's very normal to experience emotional shift as your milk starts to come in, to feel like this massive period and is like you just kind of want to cry for no reason. That's normal as your milk comes in, which is usually between 3 to 5 days. Typical for mamas to have milk that is later, around 5 days, with more of a heavier bleed. So if that was the case for you, that will be normal. For breastfeeding, you're gonna be very patient. You're gonna nurse on demand. You're gonna be drinking a ton of water and eating a ton. Don't suffer through a painful latch. If the baby's really pinchy and uncomfortable, unlatch your baby and relatch. We already watched you nurse and everything looks good at the moment, but things can shift as they start to kind of come into their body over the next couple of days. So let us know if you have any concerns there. Your breasts might become super engorged. They shouldn't before we come back at the 24-hour mark, but after that, it can be kind of normal. So cold compresses, gentle massage, nursing your baby very often is all things that we should do. For your baby, of course, I'm going to stop and ask if they have any questions, and through that, and then for your baby, I am going to run through a couple things. So if your baby, call us immediately if your baby appears to be struggling to breathe, flaring up the nostrils, retraction of the chest. If your baby looks yellow within the first 24 hours, jaundice is normal after that, but not within the first 24 hours, so please call us. If your baby is vomiting or has if your baby is vomiting large amounts after a feed, if your baby's having any trouble latching or eating, please let us know. The skin around the umbilical cord looks concerning, red, swollen, puffy, oozing. You can send us a picture and we'll keep you posted on that. If your baby's having a difficult time waking after 4 hours and you're unable to nurse, you can keep us posted and we can give you some tips and tricks for that. You're really going to want to be nursing your baby every 2 to 3 hours. That helps keeping their blood sugars up and helps with their weight gain. Things to know about your baby: it's normal for your baby to have irregular breathing patterns where they like and then they hold it and they so that's normal. What's not normal is like I was talking about before. If your baby's gonna have dark meconium and it's gonna transition as your milk does to light yellow seedy poop, that's normal. There might be a little pink in the baby's diaper. That's also normal. That's the hormones of your baby that is kind of passing. So that's nothing to be concerned about. You don't need to bathe your baby. The vernix is gonna absorb into their skin, but you are more than welcome to give them like a little sponge bath if you need to. You shouldn't submerge them until their umbilical cord is off. If you can take the baby's temperature morning and night, also that can be your partner's job. Baby's temp should be above 97, but not above 104. So if that's the case, let us know. If your baby is below 97, you're going to want to take off all of baby's clothes, put them skin to skin directly with you. You can put a heating pad on baby or just wrap your baby in blankets and see if they warm up. And I think those are all the things. Normal for baby to spit up small amounts, not normal for baby to be spitting up an excessive amount. So you can keep us posted on that. And then after I do that, I will say, do you have any questions? Do you have any concerns? Do you have anything that you want to run through before we leave? And I think I covered all the things.